Hi, I'm Craig Davis, and I just want to show you a few strengthening exercises for your shoulder. These exercises are useful for a variety of diagnoses. So this is something that your doctor would recommend, for example, either for certain conditions or at certain phases of recovery following some sort of surgery on the shoulder. So I just want to show you 6 basic exercises that are good for strengthening. The first one is external rotation. This is one of my favorite exercises for the rotator cuff. These exercises can be done with a band like this, an exercise band, or a weight. Can do either way with all these exercises. With external rotation, the key is to have the cord attached to the side, and the motion is going to be external rotation like this with your elbow at your side. External rotation. And the key here is to do the full range of motion from internal all the way to external and get resistance the whole way. With all of these exercises, the key is to have enough resistance so that after doing 10 to 12 repetitions slowly, the muscles are fatigued. Okay, so fatigue, there's a difference between the pain of the condition that you're suffering from and fatigue of the muscles. We don't want to aggravate the condition, but we do want to fatigue the muscles. So that's what we're looking for here. So 10 repetitions slowly. Slowly out, slowly back. Slowly out, slowly back. That's the first exercise. Second exercise, internal rotation. Although I'm using the other arm, that's just so I can keep facing the camera. Internal rotation again, you want to move to where you've got tension the whole range of motion, and internal and external. 10 to 12 reps slowly. Okay? Internal and external. If you don't feel like you have enough tension, you can step away a little further, get yourself more tension. The point is to have enough tension so that at 10 to 12 reps, the muscles are fatigued. That's the second exercise. Third exercise is lateral abduction. Lateral abduction. So from here, I'm exercising my right arm. I want to have enough tension so that I can do this full motion, up and out, 10 to 12 times, slowly, and that should be enough resistance that fatigues the muscles, okay? 10 to 12 reps, lateral abduction. One key with these exercises is when you're seeing a physical therapist, they might tell you you need to have your hand in a certain position or your shoulder in a certain position. And everybody's a little different, and every condition you might have is a little different. And the key here, from my viewpoint, is to adjust the position of your arm and your hand so that you're not aggravating the condition. So for example, coming up to the side like this might hurt, but maybe if I come a little more out in front, not all the way, but maybe just a little adjustment there, and all of a sudden it doesn't hurt as much. Or maybe I find that if I rotate my hand, my thumb up, now it doesn't hurt as much. It's okay to make little adjustments like that so that you minimize the aggravation of whatever condition you're having. You still want to fatigue the muscles, okay, but minimize aggravation of the condition. The next exercise is abduction leaning forward, okay? Leaning forward, now when I'm abducting, I'm exercising the back part of the rotator cuff and the deltoid muscle. So this is a little bit different than the other muscles. Again, slow, deliberate movements, slow up, slow down, and enough resistance so that you fatigue the muscles by the end of 10 to 12 reps. Fifth exercise is a rowing motion. Again, enough resistance on the band so that I get good fatigue of the muscles by the time I do 10 to 12 reps slowly. The last exercise is a pushing motion, again from back to front. This is almost like a press or a push-up. So those 6 exercises, if done regularly, 3 sets of 10 to 12 of each exercise, is a really good combination of exercises to strengthen the rotator cuff muscles and the shoulder girdle muscles. I want to emphasize as well that all of these exercises can be done with weights instead of a band. A band is one way to do it, but you can also take a hand weight, 6 pounds, 8 pounds, and do the same exercises. Now the key though with a weight is you have to be adjusted in your body position so that gravity is doing the resistance. So for example, for the lateral abduction exercise, I can be standing for the weight. But for the external rotation exercise, I need to be lying down. So on a table like this, for example, this movement with a weight in my hand, that does the external rotation exercise. All right? I'd have to be on my other side to do the internal rotation exercise with a weight. Does that make sense? And for example, for the rowing motion, I would have to be leaning forward and pulling straight back with a weight. So all these exercises can be done with weights or bands, but you have to change your body position if you're using weights so that gravity is providing the resistance in the right direction. Hopefully that's helpful. I look forward to seeing you in the office.